A very good morning to all of you, my dear friends. Myself, Dr. Yusuf Chunawal. I'm basically a pediatric dentist, and I am in the process of preparing a special pediatric dental education series. So, this is one of the lectures related to that. And the topic which we're going to discuss today is the aims, objectives, and the basic history of pedodontics and the scope of pedodontics. So, I will just share the slides. So this is the topic for discussion for today. That is the aims, objectives, and the basic scope of pedodontics. Now we will be covering the topics under the following heads. That is basically the introduction, definitions, history, pediatric dentistry, status in India, and aims, objectives, scope of pedodontics. Because we should know what is the scope. Because many of you all would want to specialize after your graduation in the field of pediatric dentistry. So you should know what is the scope and the present trends in pediatric pedodontics and the differences between child and adult patient and something called as a pedodontic triangle also. So now first we talk about the definition of pedodontics or pediatric dentistry or children's dentistry as you can call it. So a very nice definition was given by Stewart way back in 1982. He said that pediatric dentistry as the practice and teaching of comprehensive, preventive, and therapeutic oral health care of a child from birth to adolescence. And it is construed to include care for special patients who demonstrate physical, mental, or emotional problems. So this is the basic definition. So what does it cover? It is the teaching and the practice. Comprehensive means complete, preventive and therapeutic, because prevention is better than cure. So a lot of stress is there on preventive aspects also. And one more special group of kids that is included is the special children. Children who have various medical conditions like slow development, then they have they're medically compromised. You have conditions like autism, Down syndrome, a variety of these things. So they fall in the category of specialized children. So they are also included in pediatric dentistry. Another definition was given by Pinkham. He stated that pediatric dentistry is synonymous with dentistry for children. And it exists because children have dental and orofacial problems, and the genesis of dentistry for children unquestionably is allied to dental decay, pulpitis, and the inflammation, and pain associated with infected pulpal tissues and suppuration in alveolar bones. You can't call this a definition. Maybe he's just given an explanation of what all will be there in pediatric dentistry. Boucher, way back in 1993, gave this particular definition, that it is a branch of dentistry that includes having a child accept dentistry, prevention, detection, restoration of primary and permanent dentition, applying preventive measures for periodontal therapy, dental caries prevalence, intercepting and correcting various areas of malocclusion. So here it becomes more of a descriptive part. He's mentioned what all will be there or included in pediatric dentistry. Now, I really like the definitions of AAPD, that is the American Academy of Pediatric Dentistry. They gave this definition in 1999. That pediatric dentistry is an age-defined specialty that provides primary and comprehensive preventive and therapeutic oral health care for infant and children through adolescence, including those with special health care needs. It's a very complete definition. Now, the basic introduction. Now, where did this word pedodontics come from? Okay, it is derived from a Greek word. Pedo is derived from the Greek word paies, meaning child, and dontics, as you can understand, is the study of teeth. Okay, child and teeth. So, study of children's teeth is pedodontics. Now, these kind of warnings have been found. No children around in these areas. There was a time when dental clinics were very, very biased. No dentist wanted to treat children. It is very, very difficult. I mean, I can give you a simple example. Like, see, when you are performing, in case of an adult, I mean, the process is very simple. You examine his teeth, you examine the intraoral and extraoral structures, and then you come to a conclusion that, okay, this tooth has this particular problem and we need to do this treatment, and this is the importance of the treatment, and this is the cost factor for this treatment. And the patient says yes, and then he opens his mouth, then you give the local anesthetic, and then you start with the procedure. And after the procedure is done, you give post-operative instructions, and that's about it. Now, in a child, what happened many a times? The child is crying outside your clinic itself, and you start wondering, what have I done? Sometimes the child is crying on the dental chair. The child refuses to open mouth. Sometimes it takes 10 minutes, 15 minutes, 1 hour, and you are unable to even open the child's mouth. Okay, fine. A situation arrives when finally the child opens his mouth. Then he's not allowing you to examine it properly. Then you try to want to make radiographs, you're unable to make radiographs. He moves while you are making a radiograph. Then the radiographs comes improper. There is elongation or whatever, and you cannot diagnose or detect anything. That's one problem. Then the other problem at times you can face is that the child is open his mouth, you have managed a radiograph, and the moment you start with the drilling, or the moment you start with the procedure of local anesthetic, the child is not allowing. He moves. Okay. So basically, pediatric dentistry is not only time consuming, not only is it difficult to practice at times, but you require a lot of patience also. Now we are working on the patient. I mean, your adult patient might not give you a kick. He might not, like just move his head, shake his head vigorously. Anything and everything can happen when you are treating a child. So it becomes very difficult. What was becoming more and more difficult for the adult dentist or a dentist who was practicing adult dentistry to treat children. So many clinics clearly stated there was no treatment for children under the age of 14 at this clinic. And most dentists also gave a very negative knowledge influence to the parents. And most common excuse that was offered that they were milk teeth and they will fall on their own. So treating them would be a waste of time and money. That was the attitude even of the doctors at time, the dentists at time, because they could not manage. Then today dentistry has progressed and it has been realized that if you want a healthy adult, you want a healthy dentition in adult life, you have to take care of your meal. Okay. And initially, the children were brought to the dentist only when there was pain. There was never a plan. So this visit would be at the age of 4 years, 5 years, or sometimes even at the age of 8 years. So the pain in tooth is not the first sign of a problem. It is towards the conclusion. So when the patient comes in severe pain, many times the option only available to you would have been extraction. So if the child is brought early, you can say if he is brought when tooth comes in the oral cavity, when the first tooth arrives in the oral cavity, that's the time if he is, brought, and a lot of instructions are given by the pediatric dentist to the parents. So all further issues can be preventive. So parental counseling becomes a great factor because many times the parent himself is not aware. Okay, because everybody unfortunately waits for pain. Now we'll go a little bit into the history of evolution of pediatric dentistry. Now records in history show that ancient Egypt, no caries was found in children's teeth. In between the years 1560 to 60, Eustachius described and showed illustration of both permanent and primary dentition, and Geraldi writes out theories regarding tooth eruption and exfoliation. Joseph Hurlock published the first book on children's dentistry. Okay, and the title very clearly states that the causes of acute symptoms arising in the dangerous period are told about in the dangerous period. So childhood was considered a dangerous period. The child having a toothache was considered very, very dangerous. Dangerous in what sense? Danger to whom? For the dentist himself, because it was very difficult for them to manage even at that time. Now, Robert Buenon, who's considered as father of pedodontics, he was the first guy who spoke about the importance of deciduous dentition. Okay, because our milk teeth important. Because what happens many a times the attitude, even now what is observed, The moment you examine a child and you propose a lot of treatment, the first question the parents will tell, sir, why you want to do any treatment? As it is going to fall. Yeah, they're going to fall. That means what? Importance is not there. You just remove them or do some simple treatment and let me go, because new set is going to come. Everybody is concerned of the permanent dentition because it's going to stay permanently. So now Robert Binon publishes his essay on the diseases of the teeth, where for the first time various dental problems in children were discussed. And it is demonstrated that extraction of decayed teeth is not dangerous, because long time back, and even now, many patients, when they come for an extraction and when they come for dental treatment and you suggest that you might have to remove your teeth, the first thing they ask, will there be no problem in the eye? Because many people previously have associated dental removal with they connected dental removal and eye problems at the same time. So what would have been the background behind this? Why this kind of a story came up? Now, if you go maybe 100, 150 years before, the main reason for dental problems, or the major dental problem which the adults faced, was mobility and periodontal disease. Okay, caries was not the number one disease. Teeth were getting lost because of periodontal disease, and many a times the patient would be 50 plus. Okay, and his teeth are moving, and in those times when he used to remove the tooth, invariably he would be having an associated eye problem also. So many a times his tooth extraction and cataract operation coincided. So maybe that would have been the reason that this particular concept came, that if you remove the teeth, your eyesight also will be affected. And in 1743 also, Robert Binon introduced a concept of serial extraction also. This serial extraction will be covered in the later topics later on. And he founded the first dental nursing home in Paris and tests that the composition of new toothpaste he makes always with a view to improving dental care. In 1747, he was appointed dentist of the daughters of Louis XV and the King's Children's House also. So Robert Binon stressed on children dentistry, and he was appointed for the kids also. Then we have Minnie Evangeline Jordan. She was also considered one of the pioneers in the field of pediatric dentistry. She basically graduated from California in 1898, and while she was in dental school, she ran an oral health clinic at an orphanage in San Francisco. Now, Jordan also taught elementary school and worked as a dental assistant while she was training to be a dentist in Berkeley, and then opened her own dental practice in Los Angeles. Then finally, she was elected as a second vice president of the South California Dental Association. And slowly and steadily, she organized a program for Los Angeles County Dental Society featuring all women dentists also. Okay. And finally, the University of South California invited her to lecture on pediatric and operative dentistry. And by 1909, she had limited her practice to children. Okay. And in 1910, she started a section of women's dentists within South California Dental Association also. And she has given innumerable lectures, especially in 1916, she gave a lecture to the Los Angeles County Nurses Association on relation of teeth to the development of the child. And she also presented a paper, relation of food to developing teeth. Okay. And she concluded there that fewer sweets and more milk, coarse grain, eggs, and vegetables in the children's diet. The role of sugars came in, sweets came in. In 1921, she became the first president of the American Association of Women Dentists. And finally, in 1925, she published the first textbook on the subject, Operative Dentistry for Children. Then in 1926, Dr. Samuel Harris also was considered as the father of children's dentistry organization worldwide, and he starts the Detroit Periodontics Club. In 1927, the Detroit Club, which is now named is the American Academy of Promotion of Dentistry for Children. And finally, in 1940, you had the ASDC, that is the American Academy for Promotion of Dentistry for Children, renamed as, see, they've used the word promotion. Okay, because pediatric dentistry was not considered so important. But slowly and steadily, since a lot of problems were arriving and a lot of problems in adults were being associated to childhood caries, that's why they started using the word promotion. They had to promote or propagate the importance of milk tea. And this academy was named American Society of Dentistry for Children. This kind of boards were seen, patients below 10 years of age not treated in the clinic because it was a headache. Not all children, they look very cute. They're very nice to talk to, but when they are on the chair, they are extremely difficult and becomes a nerve-wracking experience for the dentist at times. In 1947, as I mentioned, American Academy of Pediatrics was founded, and 1984 AAPD, American Academy of Pediatrics, was renamed as American Academy of Pediatric Dentistry, and finally the Journal of Children's Dentistry also started. Then we had the Italian Society, SIOI, was founded in 1964, and then the European Journal of Pediatric Dentistry is the official publication entirely in English, was initiated. It has 2 issues. See, why we should know this history? Because sometimes history is also asked in the multiple choice questions, that who's the father of pediatric dentistry, who's the father of this, that. All these are MCQ. Who was Evangeline Jordan? Then there will be 4 options. So history at times tells you the importance of the branch, also that how it originated, how it is progressing, so you can appreciate better. And from the exam point of view, if you have to ask me, there can be a, like MCQs especially, it's very, very helpful. Then in 1967, CDA, the International Symposium of Children's Dental Health, was conducted in London Hospital Medical College. See, these years are important because this was for the first time that this particular kind of thing was happening. And finally, IAPD, various activities were promoted. And then finally, the International Association of Pediatric Dentistry was also formed. And then the International Journal of Pediatric Dentistry was introduced. And we should know the Indian history also. What is the Indian history? The first dental college was which? Calcutta Dental College, or now it was founded by Dr. Rafiuddin Ahmed, and he's considered as father of dentistry in India. And as well, and A.R. Ahmed Dental College is there in Calcutta. It's still there. It's still functioning. It's one of the best institutions in the country too. And in 1950, the Government Dental College Amritsar was started pedodontics as a specialty, because some of the colleges were founded early, but pedodontics as a specialty was started here. Then in 1978, pedodontics was introduced as a specialty for undergraduate, because previously it was just a part of ortho, or it was part of endo, that kind of a thing. It was a combined subject. Okay, it was not declared a special branch. Then in 1979, Indian Society of Pediatrics and Preventive Dentistry was formed, and first conference was held at that time. In the 1982, Indian Society of Pediatrics and Preventive Dentistry becomes an affiliated member of IADC, that is International Academy of Dentistry for Children. Now, pedodontics as a specialty, that is the master's or the postgraduate program, was introduced in the following colleges. First is the Government Dental College, Amritsar, in 1950. King George Medical College, Lucknow, in 1967. Then PGI Chandigarh in 1978. Government Dental College, Bombay, in 1982. And CODS, Manipal. It became the first college in South India to start pedodontics as a specialty. Then a little bit of brief history of ISPPD, that is the Indian Society of Pediatrics and Preventive Dentistry, takes up its first conference, and Dr. B.R. Vacher becomes the father of Indian pediatric dentistry, and its basic constitution was drafted by Dr. Amrit Tiwari, and contributions by Dr. B.R. Vacher was unanimously and various contributions done by B.R. Vacher in relation to pediatric dentistry. He was unanimously made the lifetime patron of the society. Then M.L. Gaur was elected the first president. Then Amrit Tiwari became the first general secretary. In 1982, ISPPD became an affiliated member of International Academy of Dentistry for Children, and a journal was also started. Okay, so this is the brief history. And what is today the position of pediatric dentistry? It is recognized as a proper specialty, which is not based on a particular skill set, but it is encompassing all of dentistry's technical skills against a philosophical background of understanding child development and health and disease. The focus has changed from just providing restorative or surgical treatment to disease prevention and interception. Now, a little bit briefing. Dental caries is the single most chronic childhood disease. It is 5 times more common than asthma. And it is more common than early childhood obesity also, and 20 times more common than type 1 diabetes. Mouth breathing and sleep disordered breathing, that is SDB, is also one of the most common diseases in children, and is therefore time for a breakthrough in thinking and a clearly defined vision for developing strategies to disease management. Okay, and the American Dental Association, the American Academy of General Dentistry, and AAPD also recognizes the dual role of a pediatric dentist is similar to that of a pediatrician and gynecologist and even internists in medicines. Okay, now people have realized that, okay, a periodontist is somebody different. Like pediatrician, everybody knows. A child specialist, everybody knows. But a child specialist dentist also exists. Now people are aware. Now, I mean, in these past 8-10 years, past 20 years, now people have started asking, do you have a child specialist? And they come to our practices. Okay, and it is of utmost importance that children must obtain collaborative care from the dental and medical team both for a complete physical, mental, and social well-being. So the periodontist is now considered part of the team of the pediatricians also and gynecologists. The role of the pediatric dentist has suddenly gained importance and momentum. So I'll end my lecture at this particular juncture. And in the next lecture, we're going to cover the basic aims and objectives and also the scope of periodontics and preventive dentistry.